Hi, welcome to today's devotional podcast with Dr. Jacob Al. We are continuing our series on Naked and Not Ashamed Sexual Intimacy in Christian Marriages. Sexual intimacy in Christian marriages. The last few podcasts has been mainly on how to help your wife gain orgasm and we therefore think that sometimes we need to look at some of the causes of non-orgasmic wives. What are some of the reasons why some wives do not experience orgasm? And this is based on testimonies from women that some of them have been in their marriages for more than 20 years but has never experienced orgasm. And so, even though we have given a number of techniques and areas of the female genitalia that the husband can be conversant with to sort of induce orgasm, we also want to look at some of the root causes of uh, the reason why some women may not be experiencing orgasm in any form. And so today's episode is entitled Causes of Non-Orgasm of the Wife. Causes of Non-Orgasm of the Wife, Part 1. And as usual, our verse for today is taken from First Corinthians chapter 7, verses 4, and I'm reading from the NLT. It says, the wife gives authority over her body to her husband, and the husband provides power uh, uh, and the husband provides power over his body to his wife. First Corinthians 7:4. So we let us look at some of the common physical conditions that may cause orgasm difficulty. We don't necessarily have to assume that uh, eh, women, just these wives who have been in marriages for 4, 5, 10 years, 20 years, and are not experiencing orgasm. We do just want to assume that it is natural for them, and that is why they are created that way. No one was created that way. God put those sensory glands in the female body specifically to be aroused during sexual intimacy. So God definitely has a reason for putting them there. So if that natural function of orgasm is not happening during sexual intercourse in the context of marriage, then there must be certain things that are wrong. And they need to be looked at. And so, uh, one of the areas we want to look at is the physical condition of the woman. So, when there is pain during intercourse, pleasure will be inhibited and sexual release will be hindered. So, there is no doubt that some women experience pain during sexual intercourse. And when that happens, as we have mentioned in previous episodes, the wife, instead of concentrating on having to receive pleasure, now have to fight against the pain that she's experiencing. And so it just cuts off all forms or all types of sensitivity that will things that would have otherwise given her pleasure is is causing her pain. And so she will not be in the right frame of mind to even think of enjoying it, because all the hormones and the her body parts will be working towards how to fight against that pain. And so there will be no much effort left in sustaining any pleasure that can will come as a result of their intercourse. So when there is pain during intercourse, pleasure will be inhibited and sexual release will be hindered. Now, uh, desperanium is characterized by painful intercourse. That is a condition that is called dyspareunia. It is a characteristic of painful intercourse, but it is not diagnosis. So it is a condition which is not necessarily diagnosed by doctors, gynecologists, but physical examination, including the pelvic and the rectal examinations, are recommended for uh, any woman with difficulty with intercourse. So it is a condition which is called dyspareunia must that is usually characterized by painful asexual intercourse. So it is something that every woman must get a gynecologist to sort of examine her in the area of the pelvis, and what is called the rectal examination is recommended. They are very, very much recommended for any woman who is going through the pain of sexual intercourse. So only a tiny percentage of doctors will ask uh, about the patient's sexual life. So you should never rely on your doctor to suggest how you feel. Instead, don't hesitate to tell him what's wrong with you. And it's something that obviously it's not a natural thing for people to volunteer information about their sex lives to their doctors. And these doctors will hardly actually want to probe into your privacy by asking whether everything is okay with your sex life. Few doctors would do that. And so don't assume that your doctor would know. You need to let your doctor know what you pass through during such periods. So don't ever take it for granted that your doctor will know, or don't feel shy and and keep it from your doctor. Don't feel shy about the situation. You need to let your doctor know. So instead, don't hesitate to tell him what's wrong. Take a deep breath and blush if necessary. Let it out. Tell the doctor. That is why he or she is your physician, is your doctor. So insufficient female hormones, especially estrogen, can lead to atrophic vaginitis. So it is called atrophic vaginitis, a tining of the vaginal wall. Menopause occur usually is very prevalent among menopausal women. The tining of the vaginal wall could come as a result of the insufficient production of the hormone estrogen in the woman. So, or it can occur after ovaries are removed, or when the ovaries are not producing enough estrogen. So, estrogen is a huge uh, thin hormone that uh, plays a very important role when it comes to sexual intercourse. And estrogen naturally is produced from by the ovaries. And so when a female, as part of family planning, some female will agree, some wives or couples may agree to uh, get the wife's ovaries removed. When that is done, then there is a shortage in the secretion or the production of estrogen, which is a hormone that is very, very much required for sexual intercourse. So it is something that we need to be aware of. So there is only one physical and sexual problem caused by menopause. That is so there is only one physical and sexual problem caused by menopause. That is atrophic vaginitis, which is obviously a situation that produces pain during sexual intercourse for women who are in their menopause, and that is just because there is a thinning of the vaginal wall during menopause, and so the secretion of estrogen is limited. When it's insufficient, then it causes this condition. And so atrophic vaginitis is what is called. A prescription of estrogen vaginal cream can be used to treat atrophic vaginitis. Estrogen supplements should be discussed with one's physician for post-menopausal women with these symptoms. So there is a very, very easy and simple way of treating this problem. Where of late we have things like the uh, estrogen vaginal cream, which will very much be in use when you should be in use when a woman is suffering from this condition. And obviously, there are other supplements that can be used, but it's important that I mention here again that this information I'm offering is just for information purposes. I'm not in any way prescribing these as in the context of a doctor. That is why each and every one of these situations, it is important that the couple consult their doctor, or the wife should consult her doctor and let them be aware of this situation. Now, very often, most of these doctors will be aware of these creams that are available, that estrogen vaginal creams that are available to treat such problems of estro. What is the issue that we are discussing here, which is obviously the atrophic vaginitis. They will definitely be aware of this cream, and they can prescribe it for you, and it should be able to take care of this. So there is another kind of vaginitis that is caused by infection. It produces pain and burning in the vagina. Yeast infection like candidiasis and parasitic infections like trichomonas are most common. These infections can be passed through one partner to another if not appropriately treated. So, Monstat and Guinealotrim are common over-the-counter creams used to treat candidiasis, and deflecant is also available as an oral tablet. Treating trichomoniasis infection must be completed simultaneously by both husband and wife. So these are infections, which is called the yeast infection, like candidiasis and parasitic infections. And another form of it is what is called the trichomonas. They are all very common forms of infections. Now, these infections can be passed from one partner to another. Now, so it is important that when you are going through treatment for this infection, it is important that you probably see your doctor with your husband. The husband and the wife might want to be looked at in this area so that it can be completely treated with both. In fact, there are oral tablets even available for it for treating this trichomonas infection, and it must be completed simultaneously with the husband, because if the wife goes through the treatment and you, the husband, you don't go through the treatment, it is possible that you could give this infection back to your wife. So it is an infection that can easily be cured. We have a whole lot of antibiotics these days that are able to take care of this. Don't keep it as a secret, especially if you are the wife who, during sexual intercourse, you go through this pain. It is important that you discuss it with your husband. Let your husband know, instead of just saying, I don't feel like having sex, sometimes you just, if you don't explain further why, your husband may just think that you just don't want to give in to his demand. But if you communicate this, look, honey, I for some reason these days, sex has become very painful for me. There must be something wrong. I probably have some infection. Allow me time to treat this. Your husband will be understanding. But very often, some women will not even want their husbands to know that they have some infection. Uh, but if it's an infection, it could be your husband who is giving you that infection. So it's important that you discuss it with him. Okay, it is important that you discuss it with him and probably see your doctors together, because if you go through the healing process of the infection and your husband is not treated, you could be infested again if the infection is coming from him. So it is important that couples are very open about this to one another, so that they will be able to put just cure this once and for all. So can be able to go back to enjoying one another again. There are other causes of pain in sexual intercourse, such as the prolapsed uterus, or what is called endometriosis. Endomito- endometriosis. So triosis, endometriosis. I want to get a pronunciation right, which can cause irritation and scarring of the pelvis. This is a condition, endometriosis, which it can cause irritation and scarring in the pelvis of the woman. So an injury to the broad ligament during childbirth is a rare physical source of pain for wives during intercourse. So if during childbirth there was a damage to this particular ligament, is a broad ligament in the pelvis area. If there was some scarring or some injury during childbirth, then and it's not properly taken care of, then the wife, after childbirth, resuming sexual intercourse, may be experiencing some pain. So the ligament on the side of the uterus is essential as a structural support. So several months after childbirth, the doctors cannot find this injury because deep penetration of the penis causes this pain. So the doctors may not realize that there's a damage to this broad, what is called that this broad ligament in the pelvis of the woman, until she probably resumes sexual intercourse with the husband, and then she will realize that each time the husband penetrates her in a very deep way, then she feels this pain. If that happens after childbirth, please, wives, see the doctor, see a gynecologist, and explain to them the pain you experience when your husband penetrates you, and they would look out and see if there had been an injury to these ligaments. Okay? Don't keep it and suffer in pain alone. You should ask your doctor to check for this tear if you develop pain 1 or 2 months after giving birth. You need to let your doctor know. Let them check if there have been injury in this area of your pelvis. Now, it may be necessary to repair the tear surgically to provide relief. So some women may not experience relief in this pain until that ligament is surgically repaired. And if that needs to happen, please take steps to do it. The earlier this is done, the better. Keeping this pain over years, excuse me, and not getting your doctor involved to be able to help in this area could be a costly mistake. And so, women, and for that matter, men, please support your wives in this area, especially if she didn't have this problem before childbirth, and after childbirth, she's disinterested in sex anymore. Then there may be some pain, some tear in this ligament that is causing her pain during sexual intercourse. And it needs to be discussed. And you both needs to see a gynecologist or a doctor who will examine to confirm that there's a tear in this ligament, which can surgically be fixed. So that the woman can get relief in this area. So another thing is what is called involuntary spasms. Involuntary spasms of the vaginal entrance muscle can also cause pain by vaginismus. Vaginismus is another condition that is caused by involuntary spasm in the vaginal entrance area, a term used to describe involuntary spasms caused when inserting the penis. There are times when a muscular spasm is so severe that it can be challenging to insert even a little finger into the vaginal canal. So after childbirth of a baby, after the birth of a baby, after the pelvic uh, operation, okay, operation, or even the time of starting a second marriage, this painful condition often occurs immediately right before the first attempt at intercourse. So let's explain this. So this is another form of this is another condition that could cause pain, vaginemus, which is the term that is used to describe the involuntary spasm caused by whenever anything is inserted into the woman's vagina, and it could be something that took place, and this could happen after childbirth when the vagina had to expand for the baby to come out, and there could be this problem could result, and the woman may not realize it until she decides to when she decides to resume sexual activity again. Then she will realize that it's even very painful for the husband to penetrate her. Even just anything close to the opening of the vagina will be very painful. And that is what is known as a condition vaginemus. Vaginemus. And it can be taken care of. It can be taken care of. And so it is important that this is looked at. So, and again, if you have been in a divorce situation where for a period of time you have not had sexual intercourse, then you remarry, and for the first time your new husband is trying to penetrate you. You could probably also have develop and there's pain, then you could also have developed this condition called vaginismus. It is a condition where it becomes very painful to insert anything into your vagina. And even if you make an attempt to use your index finger to insert, you will be able to know if you are suffering from this condition. So it is a condition, the first attempt at which of intercourse. So following the following procedure can usually eliminate vaginismus in about a week. If you follow this procedure that Dr. Ed recommends for his clients over the years, in a week you probably will be able to overcome this problem. Dr. Ed Whit will usually handle couples who consult him with the problem of vaginismus in this way. The husband enters the doctor's office after putting on a rubber glove while the wife is positioning herself for pelvic examination on the doctor's examining table. Now, instructed to place one finger well lubricated into the wife's vagina, he tries to put the finger into her vagina with a finger oil. Now, it is important this is done in the doctor's office because you are first trying to determine the level of pain that your wife is going through. So it is something that you should do. You should visit the doctor with your wife. Now, Dr. Ed, as I have mentioned, the author of this book had been in practice for a gynecologist in practice for over 30 years before his passing away. So his clients who consulted him with this problem of vaginismus, which is a condition where it becomes very difficult for any little insertion, anything to be passed through the vaginal canal, it becomes very painful. Then it is a condition that needs to be taken care of. And he usually did this by involving the husband in the process of determining how painful this is. And so you, the wife, and your husband, you come to his clinic. He makes the wife lie in a position that he usually would take in examining the pelvics of the woman. And then he will allow you, the man, to wear gloves, and very well lubricated gloves, and he would instruct that you, the man, you try to insert your index finger into your wife's vagina, and you are instructed to be very, very careful in doing this. You don't just trust it in right. You want to put it in, make an attempt to insert your index finger into your vagina, and immediately you will see her reaction. The pain she would experience, you will see it from the way she either wail or react. And then the doctor would then ask from between 0 and 10, what is the level of her pain, as the husband continues to try to maneuver the index finger a little much into her vagina. And the doctor, from this exercise, will be able to determine how painful this is. And once that is done, the doctor is then able to sort of recommend some exercise that needs to be done for this to be able to be cleared within a week. And so it is to demonstrate the severity of the spasms of the muscle around the outer 1/3 of the cervix to both husband and wife. So the cervical area of the woman. So doing this, the husband wearing the gloves and the inserting the index finger into the wife to determine the level of pain that she's going through is all a process of examining his level of the level of pain of the wife. So when the husband's index finger is placed into the vagina, it becomes immediately evident that this contraction is substantial and tense around the vaginal opening. So, as I mentioned, once the husband is wearing the gloves and the index finger is well lubricated, he makes an attempt to insert it into the wife's vagina, and there is an immediate contraction of the muscle area, and it becomes intense because of the condition that she's in. And she will be able to tell the level of pain that she's going through with this exercise. So, it is obviously so when the husband's index finger is placed into the vagina, it becomes immediately evident that this contraction is substantial and tense around the vaginal opening. So in the vagina, down towards the rectum, slowly, steadily, pressure over a few minutes will relax the muscles. So in this type of exercise, the doctor gives instructions to the husband, and with the index finger in gloves and well lubricated, the doctor guides the finger of the husband as he inserts it into the wife's vagina in lengths, in very gradual lengths, just to relax the muscles around the vaginal area. So, however, like any muscular spasms, it will become painful if too much digital pressure is applied rapidly against it. So, it is important that the husband is very careful and gentle in trying to push his index finger into the wife's vagina. It is very, very important that he's very slow and methodic and listen to the instructions of the doctor as he is doing that. But the goal is to get it as deep into her vagina as possible and as slowly and tender as it can be. Uh, just placing the lubricated finger into that area will sort of bring some relaxing, slow, steady pressure over a few minutes, will sort of relax the muscles around that area. However, like any other, as mentioned, like any other sperm, muscular sperm, it will become painful when too much digital pressure is applied on it. So that is why I said the husband has to be very careful in doing this and must listen to the instructions of the doctor. So the husband and wife will take 3 or 4 graduated uh, uh, dilators. Graduated dilators are used and use them twice a day. So graduated dilators are available for the exercise in the treatment of this condition. Okay, it should be used twice a day. A wife may feel more comfortable inserting the dilator herself at first, just until she gains confidence. So the dilator is a plastic rectal dilator. It's a plastic thing, just like in the shape of a ball pen. That is how it is, but it sort of dilates when inserted into the wife's vagina. So the doctor will usually give 3 to 4 of these dilators, and then encourage the wife to sort of find time to insert it into her vaginal area a number of times. So the husband and wife should take those dilators and try to do that twice a day. So she should start by trying to do it herself. But once she gains the confidence, then she can then guide the husband to be part of the process of inserting those dilators into her. Okay, then as they do it together, the idea is the husband will begin to empathize with the wife, because each time he tries to put this dilator in, he will have the opportunity to experience some of, at least see some of the contractions and the pain that the wife has to go through, if it was a physical penis that was being inserted. But it is all just to prepare the confidence of the woman. A reality available. So in reality, this set is a set of plastic rectal dilators are available at most drugstores. These plastic erectile dilators are available at most drugstores. The more extensive version looks like a rod, a little bigger than a fountain pen. So these plastic dilators, they are available at any drugstore. You ask the drugstore keeper or the pharmacist that you're looking for a plastic graduated dilator, and they will be able to give that to you. So the 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 extensive version of it is like a rod, a little bigger than a fountain pen. Pre-insertion lubrications is essential. So it is important that you get the cream that the doctor has recommended for you for this exercise. It is always important to lubricate the dilator or even the finger of the husband before it's inserted into the wife's vagina. So a pre-inserted lubricant is essential in this area. Now, the wife leave the dilator in the vagina for 20 to 30 minutes after it has been inserted. One of these should be retained in the vagina by the wife for several hours each night if it can be easily inserted. So it's this dilator, that this graduated dilator that can be gotten from any drugstore. It is recommended that the wife, with the help of the husband, or even if the husband has learned how to gradually insert it into her without any pain, she should keep it in there for 20 to 30 minutes after it has been inserted. And one of this should be the wife should be able to retain it one each day for a protracted period of time, several hours each night. Okay, so as the woman uses these dilators once or twice a day, she gradually becomes more comfortable with the idea that she may be having something in her vagina without feeling any pain. So the purpose of this dilators is, as often as is inserted in her, is to give her the comfort and relax those muscles that otherwise will begin to trigger pain when anything is inserted. Doing this a number of times over a week invariably should be able to bring relief to the wife. Now, we will continue how gradually this can transition from the dilator into the actual penis of the husband being inserted. After you have done these exercises for some time, then you will be able to realize that she doesn't feel pain anymore, even when they are having normal sexual intercourse after they have gone through this. So there is no sexual problem that does not have a cure. Very often, talking about it, first of all, as a couple, discussing it as a couple, and then discussing it with your physician or a doctor is very important. And besides, if you are a Christian couple, there's nothing that is impossible for the Lord. This condition could be healed by the Lord. And there's nothing wrong crying to the Lord for healing in this area, even as you take these practical steps to bring the healing. Okay, so God is interested in this. Don't think that you don't want to disturb God about a sexual problem, sexual pains that you are, so you don't even want to ask the Lord for healing in that area. God is ready to heal any part of your body, and He's interested in your well-being and your pleasure. So, if you are believers, you want to talk to Jesus about that, and He will be able to take away that pain because He bore the pain on the cross of Calvary for you. You don't have to feel pain when you are engaging yourself in the most pleasurable thing He has gifted to you in your marriage. Pray with me. Let's pray together. Our Lord and Savior Jesus, thank you for the knowledge we have gained today. I pray that you come into our lives right now as a couple, come into our marriage as a couple. We commit this problem of sexual intercourse pain in the wife. We commit it into your hands. You bore our pain on the cross of Calvary, and therefore, a gift that you have given to this couple to enjoy should not be a source of pain, but should rather be a source of pleasure. So we ask for your healing. In Jesus' precious name I pray. Amen. So, beloved, thank you for taking time to listen to today's devotional podcast. Now, there are a lot of pronunciations that I made that you probably were not able to grab it. Please go to our YouTube channel. The video will be there, and you can play the transcripts. And if you also go onto our website, www.authenticlifeidentity.com, click on devotionals, you will see the transcripts or the written version of this devotional in there, and you will be able, or you can even, you see it on Facebook. If you are a friend or you are not a friend, if you are not a friend, or you can send me a friend request and I would respond. But you can always find the written version of these devotionals on my Facebook webpage, or the website of authenticlifeidentity.com, or you can also get the transcript from the YouTube videos. Please, thank you so much. If you have any comments, we will continue through the exercise of having to get the healing in this area in our next episode. Thank you for taking time to listen to today's devotional podcast. Don't forget to click on the red button. It will send you into our promo, and then you can click to be a subscriber in our YouTube channel. That way you don't miss any of these sessions. Thank you for taking time to listen to today's devotional podcast. God bless.